distinguished guests and all the participants who have joined us today in this webinar. This dialogue is a part of Global Sustainable Development Week that we are celebrating through University Global Coalition. And IIHMR university is hosting this on the theme of collaborative academic action for good health and well-being. This evening, we have with us a very distinguished personality, Mr. Ramu Damodaran, who is the founder head of United Nations Academic Impact, the pioneering initiative of UN to link the universities for mainstreaming academia in UN agenda. Most welcome, Mr. Damodaran. We have with us Dr. Professor Kayakos, Provost of Business School of Innovation and Business and Rector, Chancellor, Vice Chancellor of many institutions and universities across the country. Thank you for joining us, sir, this evening, and most welcome from the organizing team. We have Dr. Vinita Gupta, Vice Chancellor of Saito University College, Malaysia. Welcome, Dr. Vinita. We have with us Mr. Milenko Gudik, who is a great expert in sustainable development and capacity building for sustainable development, founder of one of the prestigious faculty development programs, international IMTA in Slovenia and currently based in Serbia. Welcome, Mr. Milenko. And he also chairs this United Nations Principles for Responsible Management Education Anti-Poverty Working Group. We have with us our president, Dr. P.R. Sodani, dynamic leader and very strong believer of sustainability and healthcare and how integrated way of healthcare could be promoted for sustainable development. This panel, this dialogue is focusing, and this is very, very uniquely tailored, as we are linking 3 sustainable development goals. One is academia, that's goal 4, that good education, how we can collaborate for good education, and then at the same time, bring institution in healthcare education, healthcare management education. We are linking it to goal 3. So 4 and 3, and because we are talking of partnership for the goals, and we will be exploring the dimension of innovative partnerships, so we are touching goal 17. So goal 17 for goal 3 through goal 4. That's the agenda for this evening. We also have from Zululand, University of Zululand, Dr. Dev Tiwari, who is expert in higher education and collaborative higher education. He has joined us. Now I welcome you all, and for formal welcome, I request our president, Dr. Prahlad Sodani, to extend welcome to all the guests.
Well, thank you, Professor Tripathi, and it's a great privilege for me to welcome all the dignitaries who are here in this international webinar, which is on a very important and very timely issue, that is on the collaborative academic action for good health and well-being. As we all know that the good health and well-being, it has been observed as a challenge worldwide due to COVID-19. And during this phase, the academia should come forward to lead these health and well-being aspects all around the world. I welcome Mr. Ramu Damodaran, head of the United Nations impact, academic impact. It's a great pleasure for me to welcome Dr. Ramu Daramudran, and he's a great scientist, great leader, worldwide known for his work around the world. He's a great philosopher, he's a great thinker, and also promoting the agenda of sustainable development goals globally. Sir, we are really delighted to have you here, and we are also delighted that IIHMR University, which is one of the premier university in the country in the health sector, and we promote public health environment in the country. We are really delighted to host this international webinar with our dignitaries from worldwide, the speakers who are very distinguished speakers in the webinar. And I believe that at the end of this webinar, we will go ahead with a way forward, how to collaborate academic institutions, how to collaborate the higher education institutions for the sole purpose of health and well-being. At IIHMR, we are promoter of sustainable development goals. We are working very closely with the government institutions. We are also working with non-governmental institutions and also the private sector, that how we can build an environment in the country to achieve the sustainable development goals. As we all know, the government of India is a great intention to achieve the sustainable development goals. And during this phase, the latest budget by the government of India as well as the other governments, it's very clearly depicting that the governments are now very concerned about the health of the population, and they are devoting more focused budget on the health and related aspect. That has been proved in India that this year's financial budget, it is focused on the health sector. And there are a lot of innovations, lot of startups, lot of entrepreneurships. Many things are happening in India and around the world. I believe that our discussions today, that will give us a good path to move ahead. Had been engaged in the business of entrepreneurship, innovations in the health sector. We are we are educating the leaders as well as the managers who are the responsible managers for taking the lead in the health sector. Our university is working towards developing strong health leadership for the country and many other countries. Our alumni are working with the governments, with the development partners, with the NGO sector, as well as with the private corporate houses. I also strongly believe that there is a need for alignment among the various institutions, those who are working towards achieving the SDGs. The alignment is very much needed. Either it may be a private sector or it may be a government sector institutions. If we work in a close alignment, I think we can achieve these goals much faster. And that is really the need of our. Every sector have its own strength. Government and the public sector have its own strength. Private sector, they also have with own strength. So try to capitalize the strengths among the various sectors. Try to also focus on the associations of like-minded people, the professional groups, and many more things what we can do together. I will not take much time right now, since there is a time to have the dialogue among the speakers and also the participants who are attending this international webinar. I would also like to welcome all the participants on behalf of IIHMR University. IHMR University, have a legacy of 36 years in the health sector. We are very closely working with all the key stakeholders in the health and well-being center. So I believe that this particular webinar will give us a lot of lessons, lot of learnings, and I hope that our students will also take a lot of discussions carry forward later on also after this webinar. Once again, I would like to welcome you all on behalf of IHMR University. Namaste.
Thank you very much, Dr.
Thank,
Saram, for your welcome address. And now this is the time when I take this opportunity to invite a great personality in higher education, in collaborative higher education. Since 2010, he has been working continuously to promote the synergy in academic institutions through academic impact and making impact. So I welcome you and I invite you for keynote address, Mr. Ramu Damodra.
Thank you. Thank you so much, Shivji, and thank you, Dr. Sodani, for that very generous welcome. I do feel I might be under false pretenses here because I'm neither a scientist nor a philosopher, but I do believe that I have the good fortune to work in what I consider to be the greatest university in the world, and that is the United Nations. I say that because everything one expects of a good university, like IHMR, is true of the United Nations. We experiment, we try different projects, we see what succeeds, but most important, we send forth into the world the women and men in our charge, equipped as better and more capable citizens by the decisions and the initiatives we take. And the title of your seminar is so apt because those two words, hyphenated, well-being, are at the core of all that the United Nations does, because when you have an absence of peace, you cannot have well-being. When you have an absence of development, you cannot have well-being. When you have an absence of human rights, you cannot have well-being. And most critical of all to well-being is the synonym which you have, good health. And that is what I'm grateful that you have taken the trouble to focus on today. Good health in its many dimensions, physical, mental, perhaps spiritual, at a time when the world is coming to terms with the greatest crisis that we, at least in our lifetimes, have known. Today, the 2nd of March, is a rather important and curious anniversary. It was on this day in 1983 that the first compact discs, what we call CDs, were produced outside Japan. They were produced in the United States, where I am. And why I think this relates to our conversation today is because the CD brought us that immediacy, that intimacy of joy and sharing in another person's creativity. We listened to great composers, to great singers, to great orators with our earphones or on our speaker system. And so what began something that you had to make a journey for, to go to a concert hall or a theater, you were able to, within the space of 12 square inches, bring into your homes and your living rooms. I see that also as a metaphor for health, because we have so transformed ourselves from the time that we had to go to a clinic, to a doctor, to a radiologist, that physical demarcation of our day for attendance and treatment. And now, thanks to technology and thanks to the power of good management that your university so ably demonstrates, we're able to do so much remotely. And I think of 1983, when the first CDs came, as also the time when Dr. Ashok Agrawal and others around him began to conceive of this great institution in the town of Jaipur. Jaipur, to my mind, and I've been privileged to visit it on a few occasions, has always been symbolized by the Samrat Yantra in Jantar Mantar. the clock fashioned to the movement of the earth and the power of the sun, a clock without electronics or mechanisms, but a clock that remains right within a space of 2 seconds, because it depends, like all of us, upon the one thing that is constant: nature and the environment around us. Coming back to our conversation today, I think it is important, and I hope and I look forward to it, to look at health and well-being from what I know that Dr. Gudik would call, quite rightly, responsible management education, and also from the idea that management is something which not only allows us to strategize and economize and put to scale healthcare, but also something that equips us to deal with the many unexpected dangers that we find to public health in the 21st century. We have seen, for instance, over the last year, a willing rejection of facts when it came to the coronavirus. We have seen countries around the world veer in their own directions when it came to addressing the virus. What we have not seen is the unity of purpose and the sound reliance on science and truth that we needed. We have seen the essentiality over the last year of universal health coverage. You at IHMR had a wonderful webinar a week ago along with Afghanistan on the subject. And I think that brings to mind the fact that we really must recognize, not only as the Almaty Declaration on Health in 1978 declared, not only the fact that health is a human right, but because it is a human right, it is a right that must be assured with the least amount of individual liability or individual financial burden. And that calls for a complete transformation in the mindsets of governments. Because when you invest in health, you are not investing in the immediate or something that will be shown at the end of a calendar year. It is something that you will have to wait, like the United Nations itself, for succeeding generations to show your worth. Sometime, Shivji, you mentioned the Sustainable Development Goals. You mentioned the goals relating to health and well-being and their linkage to the ultimate goal of all, that of partnership. Last year, during the COVID crisis, one of the United Nations leading civil society members, Dr. Padmini Murthy of the New York Medical College, wrote an article in the UN Chronicle where she spoke about two of the Sustainable Development Goals, SDG 3, which relates to good health, and SDG 5, which relates to gender equality. And she made the point that what links 3 and 5, as any child knows, SDG 4, education. So when you go from good health to gender equality and the right of women in particular to have access to healthcare, you come back right to SDG 4, and that is education. The idea of business and innovation, which Dr. Koveliotis so amply personifies in the Berlin School, is, to my mind, particularly critical because we have a tendency to regard business as something which is entrepreneurial, experimental, managerial, and ultimately, certainly financial in terms of profit. But what if we can use these principles to actually bring higher education into the realm of practical application in the health fields? The work that Dr. Koveliotis has done among the population of older adults in Ghana, among midwives in Rwanda, bring down to earth the very practical aspirations that we have of management in terms of healthcare. Because this success, especially in our times, would not be possible without planning, wisdom, and investment, both financial and, above all, intellectual. I think also of another element which is related to this, which is the growing dependence of looking at things not only at the macro, but the micro level. The idea of working in communities with their own knowledge, evaluating it, seeing how much of it is fact, how much of it may be superstition and ill-founded, but which is important. Dr. Dev Tiwari, who I know is with us, even though unfortunately his camera is giving problems, has worked on the ethnic and medical claims of the Magro community in Nepal and what they are doing in terms of indigenous innovation. The other factor, which I'm very grateful that Dr. Shiv Tripathi has worked so extensively on, is the question of how, in the area of technology and management in public health, we have to be vigilant, as we have to be in private enterprise or business enterprise as a whole, of the danger of corruption. And this is something that we cannot underestimate. Just over a year ago, I think it was in November 2019, the former health minister of Peru, Patricia Garcia, wrote an article in the British medical journal, The Lancet. And she said, corruption is embedded in health systems. Throughout my life, as a researcher, public health worker, and a minister of health, I've been able to see entrenched dishonesty and fraud. But despite being one of the most important barriers to implementing universal health coverage around the world, corruption is rarely openly discussed. If we are really aiming to achieve the Sustainable Development Goals, to ensure healthy lives for all, corruption in global health must no longer be an open secret. Shivji, you and Dr. Nyam Sogoro, who I think is also joining us today, have taken the lead in suggesting how Africa's business schools must include anti-corruption in their syllabus. And I think this is something where I would urge, from the perspective of the United Nations, that we continue and initiate a program of continuing education on corruption so that it goes beyond the universities, it goes into the actual healthcare sector, and we empower the beneficiaries of health coverage and healthcare to realize when it is that they're being taken. Because technology, for all its benefits, and we have depended so much on technology in the last 12 months, can really breed corruption. If you have a situation where there is the power of life given to an individual, and make no mistake about it, giving a vaccine is giving someone life. And when you have the power to determine who gets a vaccine and when that decision can be conditioned by bribery, by favor, by influence, then you undermine the entire system of universal health expectation. It's a question of ethics and service. Dr. Vinita Gupta, whom I'm so happy to see with us today, had a wonderful analysis comparing the health crisis to the 2008 financial crisis, and how at the center of both is the ethical norm. It's not just a question of liquidity or volatility. It's a question of moral principles. And as she has said, to alleviate community needs while having a deeper appreciation and understanding of the academic curriculum, reflective learning through the engagement in service learning initiatives is important. And I was very moved by that phrase, because reflective learning really transforms, if you will, the entire, what we in India call the Guru Shishya Parampara, of the teacher and the student imparting education, to giving the student education and allowing her or him to reflect upon it, and in that process enlarging and broadening the canvas of her or his understanding. And not only understanding, but translating that understanding into the action upon which good health and well-being depend. We also have to counter so much the glib answers that we find to situations, particularly in health. And here I come to my parent role, really, which is in the Department of Global Communications of the United Nations, where I fear that the amount of misinformation, speculation, rumor that we are fed every hour of the day on social media really disempowers us at a time like this. Last week, we had the Jaipur Literary Festival, one of the landmark events in your great city. This year, of course, was virtual. And I saw one of the panels by someone I'm privileged to call as a friend, Dr. Randeep Guleria, who is the director of the All India Institute of Medical Sciences. And I heard Randeep talk about this idea that all of us cling to, the idea of herd immunity in the context of the virus. And Randeep said, look, herd immunity is going to be very difficult to achieve. And we can't really think of it in practical terms in a country like India. Randeep has co-authored a book called Till We Win, India's Fight Against the COVID-19 Virus. And he has said, this is going to be very, very difficult to achieve because the varying strains and varying immunity with times can lead to a chance where people may get infection and reinfection again and again, no matter how superficially immune they may be. So thinking of that, it also brought to mind the metaphor, if you will, of herd immunity. The fact that there is strength in numbers, that is the principle of this. But the converse of it is that even if there is strength in numbers, that strength is diminished, if not destroyed, by the vulnerability of one among that numbers. So if I am in a group that is immune, but I succumb, then my exposure, my infirmity affects or infects all around me. And I think that is the metaphor that we should take from our conversation today, that just as it is important for us to be part of a community, there is no substitute for our caring for ourselves, for our protecting ourselves, because it is in that point that we manage to protect others. I would like to conclude, perhaps, I'm not sure how well it fits in, but I'd like to conclude with a short couple of lines from the autobiography of Rajmata Gayatri Devi of Jaipur, when she wrote about her courtship with the Maharaja of Jaipur. And she said, when she used to go out with the man who was to become her husband, there was the challenge of outwitting our elders, of arranging secret meetings. And every now and then there was the marvelous unheard of liberty of going for a drive in the country with Jay, of a stolen dinner at Bray, or an outing on the river in a boat. It was a lovely and intoxicating time. I think of those words because they bring to mind the world we knew in 2019. They bring to mind the freedom of our spirit, of our capacities, and they bring to mind so much that we took for granted. But, as Gayatri Devi said, no matter how much we enjoyed it, there was always this fear of being discovered. And so too it is with our times. There is so much we can create. There is so much we can enjoy and cherish. But all the time we are afraid that someone will take it away from us, whether it be a virus, whether it be an oppressive and corrupt administration or a business house. And the only power we have against that is self-assurance, and beyond self-assurance, education. All of you are educators. Most of you are educators in the health field. All of you have been involved with management. That is a formidable combination. And I hope I'm right when I say that with that combination, we cannot go wrong. Thank you.
Thank you very much, sir, for in very short time combining every aspect of sustainable development and highlighting that if we really want to ensure the well-being, we have to ensure self-assurance. And here is the role that on the one side, while we are working on improving the management, healthcare management systems, also we need to work collaboratively on how we can improve the self-assurance, because health is right and we have to work on minimizing the cost of for individuals when we are going to ensure the rights. Thank you so much for your words and setting the theme and foundation for the further discussion. Now we come to the discussion round of this dialogue, and where we will be having a question answer type of question answers. First round we will reflect on some of the issues, and then we will move to round two, and then finally I would be requesting one final thoughts from each one of you. So to begin with, we have with us Professor Dr. Kyriakos, who has great experience in managing the academic institutions in healthcare, and he has introduced many innovations in collaborative healthcare management education. So, Dr. Kyriakos, looking at the global capacity building need currently, what we are witnessing now in area of healthcare management, what could be some effective ways of knowledge transfer globally? Would you like to reflect on that?
Yes. Thank you, Dr. C. First of all, I want to thank all of you for your good words, and especially Mr. Ramo from the UN. Just before commenting on what you asked, I still remember when I was a young undergraduate, because one of my degrees is in diplomacy in international relations, and I was amazed by what the United Nations have achieved. And even today, that we're a little bit older, let's say, the United Nations maybe is not the perfect framework and there are some deficiencies, but currently it's the best thing we have globally. And we need to realize this. And especially regarding the pandemic, if I want to keep two positive things, the one is to realize the progress of humanity and of technology and of all innovations, because imagine if that happened 50 years ago. And the second is all it needed was just a pandemic for us to realize what wonderful lives we all experienced before and all the good things that we took for granted. And imagine when this nightmare is over, I hope that everybody will be a better person anyway. Now back to what you asked, and I have kept some notes in order to facilitate the answer. As we know today, global development all dictate more than ever the reorientation of what we call existing educational structures. We need to create new ones. We need to respond to the challenges that students are facing. The pandemic is one of them. So the healthcare management section and domain follows this reference in full intensity. So we all know today that education landscape is changing. There are more types of learning than ever before. We have conventional, we have part-time, full-time, distance, online, all these different types. So people want more and they need to learn in different ways. And they want to support their preferred styles. They need to have access 24/7, regardless of boundaries, regardless of where they are or what day it is. So healthcare management in particular, and for all health professionals, this is a constant need, especially for those that they work around the clock and they have very limited time. So as educators, as innovators also in education, what we can do is to utilize all the latest innovative developments of technology and all the modern educational methodologies, such as what we call the open learning means, social media, mobile learning, augmented reality, all these innovations, especially for healthcare management. And I want to remind you what an ancient philosopher Plato said, which is, do not train people to learning by force and harshness, but direct them to that, and assumes their mind so that you will be better able to discover with accuracy all the genius that exists in every person. So that applies to a certain extent to healthcare professionals as well. So what are the three needs of healthcare professionals in management today? First, to recognize and achieve goals and ambitions, especially in contemporary global challenges. Then enhance their knowledge with a global perspective. Recognize in the same framework that they belong to an international community and use this understanding effectively in order to understand multiculturalism. Practice, of course, the skills and creativity beyond the regional environments. You know, let's say 100 years ago, modern diplomacy was exercised by the diplomats around the world in embassies and consulates. Now, any foreign minister can take the plane, and in a couple of hours, he can be in different fora around the world. So everything is changing. Together, education. So what does the modern, the contemporary healthcare management education needs? We need to move away from the teacher-centered to go to student-centered learning, from the transmission of knowledge to the building of knowledge, and from passive and competitive learning to active and collaborative learning. And in this model, the individual healthcare student becomes the center of educational process. So everything returns to the individual. So innovative and modern healthcare management would lead to a better knowledge of the world around us and should assist us to better cope with it. I have to quote here Salman Khan, that he said, this is the information revolution. And it is crazy that every other field is revolutionized apart from education. So these are my initial thoughts. So Dr. Siv, back to you.
Thank you very much, Dr. Kyriakos. And exactly as you mentioned, that now what with the change that is happening across the globe, one thing is for sure that 24/7 access is something which is very much needed in education. And that could be possible by combining the different modes of education, whether online, open, distance, face-to-face, conventional, executive, in one basket, so that we can move towards the higher goal, that is the providing 24/7 access. And as you mentioned, that collaborative knowledge building is the way forward. And I think that should be one of the areas where the academic collaborations must look into, that how we can create collaborative knowledge at different levels for better problem solving and ensuring better healthcare management systems. So thank you very much for your initial thoughts. And now I come to Professor Vinita Gupta. Professor Vinita, you have been working with the diverse groups of students at different levels. And now, post-pandemic, one area is emerging like sustainable development. There are some thoughts emerging that public health education or health management should be taught to everyone, irrespective of what discipline one is studying, whether it could be philosophy, it could be engineering. But one need to know the minimum basics of public health and health management. So how do you think that we can integrate, what could be some possible ways of integrating healthcare management education at undergraduate level particularly?
Thank you, Dr. Shiv. Namaste, everybody. And Thank you for having me on your panel. It was really nice to hear Mr. Ramu do the keynote, and I'm actually very excited to learn from everybody. I think how I would take your question, Dr. Ship, is the fact that let's look at education. And I think to make a significant change in healthcare, we must see a change in education. And my going into this is really threefold: the power of education and the risk of poor health. So if we look at this and we, like Mr. Ramu said, I do a lot of work on reflective learning and how we can now make students intentional learners. They then become the impact makers, and they would be the key influencers within their circle of people. And what we have in the mix now is how online teaching and learning has also changed behaviors. So I will talk a little bit about that. And for undergraduate students, I think we need to look at a little bit of the healthcare as core curriculum, right? We need to ensure that in all undergraduate programs, students understand the importance of healthcare education. We know that education can create opportunities for better health. You know, you do very well, you get a good degree, your income goes up, you have better opportunities for healthcare. But what we're trying to push for is understanding the importance of well-being, having a healthier lifestyle, having positive environments. And maybe I should just touch on one of the projects that we are doing. We do projects for rural Malaysia, where we provide breakfast in schools. And this is simply to encourage students to go to school, because they come from very poor families, and because they are hungry, they don't go to school and they don't get enough nutrients. So the whole project is about serving good breakfast in school. And how this is done is that we get the families involved. Breakfast for schools are cooked by the mothers. So what happens there is now they encourage their children to go to school. And a part of this entire project is that we work with the healthcare professionals, and they actually talk to the parents about good nutrition and, you know, what kind of foods to eat, what kind of sugars to stay away from. And what we've really seen is that with better health, the students are happier, they connect better, and we realize that they go to school, the attendance are better, their concentration is much better. So this particular pilot schools that we are working with, there are about 60 schools. They have now put in one subject in the schools, and also in first year university for that particular state. They've put in a subject where they learn about well-being and happiness and mindful living. So they spend maybe 1 hour for a 1 hour class. They spend the first 10 minutes practicing mindfulness. So we have seen a lot of improvements in the students when they do things like that. And over the last 1 year, unfortunately, we have seen some changes in behavior. While online learning, virtual classrooms have brought a bit of benefit, we now can have students from multiple countries in one of my classes. But what we are also seeing is a great digital divide. And this digital divide actually is causing a lot of stress and students are experiencing difficulty in sleeping, and some of them are self-medicating because they're worried that they cannot cope with their classes. So there are a lot of issues that we're looking at. So I think what we really need to do is connect with the students and get them to reflect on not just completing their papers or getting a first class honors, but really understanding themselves. And I'd like to say that what is really important is self-care. And how we want to do this is that we need them to understand that it is important for them to take care of themselves and to understand why we need to incorporate learning about exercise, keeping yourself positive, celebrating successes, reflecting on your behavior, reflecting on how you can impact communities. That really is it's a holistic change for an undergraduate student. And I think that is really important if we want to make an impact. So, I mean, if you let me talk, I can talk for hours. So, Dr. Chib, I'm going to just give this back to you with a few things. I just want to narrow it down to how we need to change the way we teach, to incorporate well-being, to spend time understanding students, to connect, to reflect on their learning and how it's going to impact not just them, but the community. And also to, I think teachers need to understand that they're the greatest influences, right? And they need to use that power really well. I look up to all my teachers as mentors because they have taught me things that I could never study from a book. Simply because they cared for you, they ask you about what you're doing. And what we realize is that when you do that to students and you take them out to communities, they then pass that on to a community. So if we do that in terms of healthcare, talking to students about understanding why it's important to look after yourself, they go back to their village in rural Malaysia and they actually help different communities. So, Dr. Ship, I'm going to stop here for a while and I'll take questions in the second round.
Thank you, Professor Vinita. And as you mentioned that now this is the time that we have to ensure that how education could be student-centric in such a way that we ensure their well-being while we are also making them aware about, and a lot of positive thinking components and other well-being related components can be included in the curricula at undergraduate level. And I think this aspect was also touched by Dr. Kariakus in his remarks when he mentioned the blending of different types of education modes for ensuring 24/7. I think that also has a purpose so that we can learn at ease in a very, very comfortable and less stressful way. So that's thank you for your remarks. Now I come to a person who has spent decades in capacity building. And while we have discussed about that there is need and there is a need for innovation in designing and delivering program at different levels, in combining the different modes of education to ensure well-being, what also was highlighted by Mr. Ramu Damodran in his keynote. What could be some capacity building initiative, because that's one critical factor, the human factor, who would be responsible for driving this? And for that, we cannot all of a sudden create educators from in healthcare management education to take this particular new initiative across the globe. So we need to train and we need to build capacity from what we already have, and gradually we need to build it. So, Mr. Milanko Gudik, what would be your thoughts how we can ensure capacity building in healthcare management, for healthcare management education, as well as for sustainable development goals? You are mute, I think. You are mute, Milanko.
Sorry, thank you very much for this introduction. It's really a great honor, privilege to be an active part and above all, a good listener in this webinar, which is very important. And I would like to thank you very much for your trust. It's also difficult to speak after so many great thoughts already presented, put in front of us by the keynote speaker and distinguished panelists. But if you allow me, I would like to go a little bit back uh, uh, and remind you on what a great educational psychologist, Carl Rogers, said when he was asked whom we can consider as the truly educated person in this world that is changing so fast and so dramatically. And his answer was, the only truly educated person is the one who has learned how to learn. So my first message is we can have wonderful programs with a lot of knowledge and everything, delivered or discussed. But if it is not opening the door for lifelong learning, then it is very limited in terms of possible impact. So I think the emphasis should be on learning how to learn. Secondly, around the globe and around the disciplines, be it healthcare management, agriculture, engineering, science, and so on, we learn mostly, unfortunately, we get knowledge. And knowledge is disciplinary in nature. So we go deeper and deeper in sub-disciplines, sub-disciplines, to more know about something that is more narrow. And finally, we can say we know everything about nothing because the field has become so narrow. In contrast to knowledge, understanding is multidisciplinary. So our education should look for enabling people, either faculty or students, to understand the world and to understand how they can contribute. Now, at this stage of development, I think this cannot go without considering seriously the impact of technology. Now we have artificial intelligence, which is already taking a serious role in healthcare industry. So, but the question is not whether artificial intelligence will replace doctors or nurses or any health worker. The question is how this artificial intelligence, how technology can help them to focus on the things that intelligence, technical intelligence per se cannot provide. And I think we come to the key word, which is care. I like very much a saying, I don't know whose it is, but it says, people don't know how much you care until people don't care how much you know until they know how much you care. So in our educational system, we need to create people who care. To create people who care, we should go beyond their main role. Either this role, for instance, in healthcare is an educator or doctor or nurse, but to cover also the other roles they play as administrators, as consultants, as researchers, because each of these activity complement to each other so that they can deliver. So this is to echo what we heard from our previous speaker, Dr. Vinita. We need to have a holistic approach. And lastly, about the target group. Target group should include all those who are involved in healthcare industry, not only healthcare managers, but also doctors, nurses, technicians, all healthcare workers, because only together they can provide high quality service. And when I say high quality service, let me finish at this point in this round. I think the focus should be, like in any other sector, primarily on prevention and later on healing and treating. Prevention is the key. Thank you very much.
Thank you very much, Milanko, for highlighting the role of prevention and care, and which fits very well. Like, we have to develop education system, we have to develop what you called learners, or the one who can promote attitude to learn, rather calling it educators, and who can develop those who can care, who can think holistically, who can live holistically, and who can care holistically with empathy for the greater impact. Thank you so much for your words of wisdom, and particularly distinguishing between the knowledge and understanding in context of disciplinary and multidisciplinary orientation. Thank you very much. Now we have with us Dr. McFarlane Ansel from Tanzania. Uh, Dr. Ganka Nyamsogoro has not joined, and Dr. McFarlane Ansel is expert of health care management and health management systems. He teaches at Muzumbe University in Tanzania. Uh, Dr. McFarlane, I would like to ask you, have seen the healthcare management education systems in so-called global north as well as global south. Do you find any difference, and how this difference could impact the healthcare management education in post-pandemic scenario? What would be your thoughts on this?
Thank you very much, Dr. Ship, for giving me this chance, and I'm privileged to be in the panel, one of the panelists to discuss these issues. To go straight to what you have asked, the issue of global health in relation to North and South. As you know, there are different in healthcare developments between North and South, and in terms of the equipment, in terms of technology, etc. But also, when you look on the South, we still have a double burden of disease, where we still have the communicable disease, but at the moment, the non-communicable disease also is increasing. So with this kind of double burdens of disease, it means the management also science should change to accommodate the differences which already happens. And what we can learn now is that we already have innovation, a lot of innovation which already happening from North, which we can use them, but not exactly as is being implemented at North, but with kind of modification to be applicable in our context. For example, you find we have different level of development, and the health systems in South is not really well developed. So when we have exchange program, for example, where the student from North and South can interact either through virtual learning or through physical transfer, it can also transfer those kind of knowledge, and people they can see through really practice we have different kind of disease experiences, and which means even the healthcare, it may be different. And you may find some may be having those kind of literature and information which is based on north, but when you have mixed kind of knowledge sharing between north and south, I think it can improve the health system. So when we approach on the healthcare, we should know there are context differences in terms of development, in terms of kind of disease, in terms of burden of disease. So when we are embedding on this healthcare, when we have some kind of exchange program between learning institutions in terms of virtual learning or how exchange mobility of staff, mobility of students, for me, I think it will help to improve the health status and can improve the learning environment for both area, south and north, in dealing with kind of different disease. I submit.
Thank you, Dr. McFarlane. And as you mentioned, that it's not only the difference in the technology, resources, infrastructure, but also it's about the situation in terms of disease burden and types of communicable diseases that we are facing. So our healthcare management education system should be prepared. And I think our collaborative effort should be focusing more on how we can bridge the gap. Thank you very much for your perspective. And now I would ask Dr. Sodani, because he has been in healthcare management education for long, and particularly research-based healthcare management education, that under the emerging scenario, what are the key competencies you would like to suggest in healthcare managers that we can collaborate for, that where we can focus our collaborative efforts to develop the certain key competencies areas which you would like to suggest, which you would like to recommend for healthcare managers globally? Dr. Sudani.
Thank you, Dr. Tripathi. And okay, well, it's a very great question. As far as the current COVID-19 pandemic is going on globally, and we as a higher education institution should think for that what type of skill set is required for healthcare managers post COVID-19, you can say. As we have already seen that the COVID-19, it has been I have observed it like that, it has been a catalyst to reinvent innovations and providing a lot of space for entrepreneurship. So it has been a challenge. It is a difficult time, we all observe, but at the same time, the COVID-19 has created a lot of opportunities to think widely. Unless, until the COVID-19, we were not thinking loudly. If I would like to say that, say for example, digitalization. Before COVID-19, yes, the technology was there, the interventions were there, but the people were not able to think to a larger extent that how the technology can be very helpful in managing the healthcare system globally. We have observed that the health systems, particularly in the developing countries, if we say, so we are facing a lot of issues, lot of management related issues in the health system. Say for example, supply chain management, there may be the issues of human resources for health in the remote areas. The people are not getting the services from a doctors and like that. But if we think the COVID-19 situation and now the opportunities which we have generated is that the technology can play a very important role. So I think the healthcare managers post COVID-19, they should be trained in the digital health, you can say technology. So through technology, we can provide more access of the healthcare services. We can improvise on the availability of the healthcare services. We can improvise on the results or the diagnostic reports, result, and their discussions, and finally the prescription. So the whole process of, you can say, service delivery, that has been improved with the skill set of the digital or the digitalization. Second, I would also like to highlight that since this particular situation of this COVID-19, everybody has been, impacted, irrespective of the economic status or the social status globally, irrespective of the geography. So if we see that this impact is so loudly in the community, so it means that it is not only the skill set which I have just mentioned about machine learning, automation, digitalization. This is one part, but the other part is, which we have also observed, that since everybody was in stress and there was a lot of issues related to mental health and many more, on both sides, for the providers, means for the managers, as well as for the client also. So I think some more skill set is required for the health managers are, say for example, the behavior related skill set. The people now, what we require in the health sector is they should be very flexibility. They should have the flexibility. They also should have the adaptability. So these are the few things that that we have learned during the COVID-19, that we should be more flexible uh, towards the idea, towards the approach, towards everything. And one more thing I would like to mention here, that this particular challenge of COVID-19 have also, we have learned that connect is very important among the people. Connect. Today, through the technology, we are connected. And I think the connect has improved during the COVID-19. The people connected very well. So that is also one of the aspect. One more thing I would like to highlight here, that if we talk about hospital managers or the healthcare managers, so now earlier what was the scene, that the providers were connected to the client only, but now the connection is between the internal clients also. That is also improvised somehow. The people thought that if we are connected very well within the organization, I think that is also a good learning for all of us, that the people are now more near, more connected, and that will help them to achieve a better goal of the organization. So what we require now is, we require skill set of both type: hardware skill set like machine learning, big data analytics, digitalization. All these things are coming. So I see that the next 10 years of health sector is more a digital health. So the things will be moving accordingly. The health systems are now changing. The service models are changing. And even the thinking of the clients are also changing. It is not like that the poor people of 100 years ago and the poor people of today, they are same. No, now they are not same. Even the poor people, now he has a great understanding that he requires a good health at his doorstep. So there is a lot of responsibility on the health system to provide services, better availability of the services, affordability of the services. So all these issues are there. So I see that if we see the health systems in an aggregate way, the comprehensive health care or the health systems, then almost all there are like 6 building blocks in the health systems. Okay, so human resources, service delivery, financing, leadership and stewardship. So things are changing. They are not now static. So more a dynamic world, more innovative world, and these are the skill set which I think the healthcare managers or the hospital managers should have to have a great success even in the post-COVID time. I hope that I have been able to answer your question, or we can discuss more.
Thank you very much, Dr. Sodani. Yes, exactly as you mentioned that there is a great need for both balancing technical skills and particularly optimizing the use of technology for better healthcare, as it would result into both improving the precision, reliability, and also reducing the cost at the same time.
Yeah.
So that's very much important. And to make it work, soft skill and empathy will
Yeah.
be required. So thank you very much for identifying and suggesting these skills for which our collaborative education systems should work. Now, with this, we close the first round of dialogue and we move to round two, where I would be asking, requesting each one of you to reflect with on how innovatively we can collaborate globally for effective healthcare management education. It could be related to research, it could be related to student exchange, it could be related to credit transfer, it could be related to anything that has to deal with knowledge creation, knowledge delivery, and knowledge dissemination in related to management of healthcare. But before I move to this, we have with us a very distinguished scholar, Dr. Dev Tiwari from University of Zululand, who has been Dean Faculty of Commerce and Business and Professor at University of Zululand. I would request Dr. Dev Tiwari to reflect overall, looking at the scenario. You have seen the discussion, we had different perspectives. Any concluding thoughts for the round one before we move to round two?
Thank you, Prof. Shiv Tripathi. Thank you so much. Can you hear me?
Yeah, very well.
Okay, thank you. My camera is not working. So, but I think maybe in a 10-15 minutes it might work. There is someone to help me here. Okay, after listening to all the experts and the keynote address, I see some interesting themes coming out. Let me just say some those themes, kind of summarize them. One theme that comes very clearly is, particularly that is said by the keynote speaker, that health sector is not existing in isolation. It's associated with many other sectors. So what happens in periphery, it also affects the health sector. So you can't have a policy. I mean, you'll have a policy for health sector, but you must also understand that what happens in the periphery will affect the health sector. Therefore, we have to have a united view of the society and see how health sector will respond to this. If something happens in periphery, so how is health sector going to respond? So our managers must understand that. They shouldn't just focus themselves on the doctors, nurses only, or the education, managing health. They should also focus on non-health sector shocks that will come and affect. So I think that was one important point. The second theme that I understand that also comes very well is again a keynote speaker, Ram Damodaran, said that there is a lot of corruption. We are facing corruption everywhere, and particularly in developing countries, it's more common. And so, what is happening over time? We are developing ourselves technologically, but at the same time, the corruption is growing. That means the moral capital of the society is going down. It's thinning. So at Mr. I think Mr. Milenko made this point. He said we need people those who care. All right, and how do you get those kind of people? Those people, those who care. How do you create those people? How do you produce them? Those who have commitment to the people, those who have empathy, how do you create them? So the question now is to create that moral capital again, reshape it, because we are trying to be valueless people, and that values are gone then we'll not have moral capital. We'll not have people, those who care, those who are committed. So I think that's a hidden point, that we need to build a society with values, and then it will produce people, those who care. So that's another theme that I can see. Another interesting theme is that with the COVID, after the COVID, a number of different challenges have come, and these challenges pose us as a new, we need to think of new innovations, and we are already trying to do that. But the another challenge that is coming, that probably was discussed thinly, it was a mental health condition. So since now people are not getting along, I mean, they're not mingling and those kind of things, a lot of mental health problems are coming. So all health managers must think. Somebody said, I don't remember, I think they said the more behavioral, I think Dr. Sodani said that more behavioral kind of, we need to learn more behavioral medicine, people's behavior. So it's not simply giving a tablet. You need to maybe talk to the people. Maybe we need more psychologists, a different kind of psychologists. So we'll need to build that kind of capacity. Maybe I don't know how that capacity at this point of time. The other interesting theme that I see, that through these two goals, SDG 3 and SDG 4. SDG Sustainable Development Goal number 3 is a good health for all, and SDG 4 is education for all. I think these are the two key factors which determine the quality of life. If you don't have a good health and you have a good thinking capacity, then it decides a quality of life. So these are the two important goals for sustainable development. If we are healthy and we can think properly, rationally, we can make right decision. And then once we make a right decision, right things can come out. So over the years, somebody said we are increasing access. The technology has increased the access to medicine, access to rural areas, access to more students, you know. But with access, we need to, I think the point that I think probably was not emphasized is the quality. More access doesn't mean more quality. Generally, more access means low quality. And therefore, there is a much more responsibility on the teachers or healthcare managers to maintain that quality. So that's another theme that comes out of this discussion. Um then another point I can say is there are a lot of things I can't really capture all of them. Like McPhail said about there are problems related to different kind of disease in North and South, and we need to have a specific management techniques for them. So these are some of the things that I think these entire discussion has taken place, and these are some good tips for healthcare management. Thank you very much for that.
Thank you very much, Professor Tiwari, and I hope that in next few minutes your camera also starts working.
Okay, I hope so. Thank you.
Yeah, with this we come to the end of round one, and I can see some raised hands. Definitely, we will come to the attendees, to the participants after the second round, and we will take some questions, and we would like to make it a very, very interactive panel discussion. So just please wait for a few more minutes till we conclude round two, and we will come to the participants for the question answer round. Now, with the start of round two, few things have, when we are starting this round two, few things have emerged very clearly, that while we need to focus on the disciplinary knowledge, as Milenko mentioned, we also need to touch on soft issues which are linked to the behavior and which are linked to the attitude, what was highlighted by Dr. Sodani. And in fact, this is where we need to bring the intervention, in my opinion, because Mr. Ramu Damodaran mentioned about transparency and corruption. And I think across the SDGs, across any of the indicators of sustainable development, because I have had chance to work on some of the anti-corruption initiatives, what I learned that for any of the sustainable development indicators, first thing we need to ensure is reduction in the corrupt behavior at any level. And for that, moral capital is very, very important, as mentioned by Professor Tiwari finally. So we will be looking into this and how we can collaborate, how we can work on healthcare education, management education, collaboration across the globe, which can bridge the gap between North and South, which can help in promoting the education, which is balancing the technical side, the disciplinary knowledge side, along with the behavior side, and which could also provide better access at reduced price for masses without compromising with the quality. So I move in reverse order, and now I would request Dr. Sodani to suggest some innovative ways how we can collaborate, and then we will move to the reverse order of panel one, from him to Mr. Mr. McFarlane to Mr. Milan, and that way we will move. Yeah. Dr. Sodani, please.
Yes, Dr. Tripathi. Yeah, now the issue here is that means how to promote the responsible as well as effective healthcare management education. So if we explore the available options in the education industry, that how we can be more provide a more responsible education, or I would like to say more responsive to the students' education. Since as a higher education institutions, we all are responsible to provide a good quality education to the health managers or the healthcare leaders. Now, I have few thoughts on this, that how we can promote this. First and foremost, I think that the research should be given more focus. Unless until we give a focus on research, I think the quality of education will not be enhancing. So to have a great classes, or you can say the great education, great learning for the student, I think more and more focus should be given to the research. I think the education should or the learning should come from the research in the field. So the faculty who are engaged in the teaching, they should be also engaged in some one way or other way in doing and conducting the research in those areas. And number two, that it is not only the faculty that he or she will conduct the research and come to the classroom and share the research findings and like that. But at the same time, the student community should be also engaged in the ongoing research projects and processes. So they will also learn many things by doing by the engagement in the research projects. Second point I would like to say, apart from the research, that the capacity building and training, that is also one of the area where we can do much more things collaboratively. And here again, I would like to focus 2 or 3 models for capacity building and training. One may be the fellowships, that the faculty members and the students, they should go for fellowship programs to enhance the skill set. And also we should come together to organize joint faculty development programs. And if we come together and identify that what areas where the faculty requires more strengthening, since if our faculties are strong, I think the education will be much stronger. So at the same time, we have to continuously think about faculty development and the faculty development strategies towards that end. Next, I would like to say that the industry and academia, there should be a strong collaboration between industry as well as the academia or the higher education institutions. Higher education institutions or the universities, they should not work stand alone. Since the students which we are producing, that we are producing only for the industry. If I teach my student, I should keep in my mind that my student should go in the industry and work significantly to improve the industry outcome. So unless until we have a strong connect with the industry, I think our education system cannot be further improved. It should be need based. It should be focused for the industry specific requirement. So if I say strong industry connect, it means that the industry should be invited on a annual basis or the regular basis, or some mechanism should be there that we should take the inputs from the industry leaders, that how we can further enhance our course curriculum. Since the industry is changing very rapidly, if I say healthcare sector or the healthcare industry, it's changing very fast. Whatever I was teaching 10 years back, hopefully I am not teaching the same things now today, since the industry has changed. So accordingly, we have to change our sessions, we have to change our session plan and all the methodology. Last but not the least, when I say the industry connected, but at the same time, we should also work together, the higher education institutions and universities. We should work together. Say, for example, we have a lot of associations, professional associations are already there. But whether these professional associations are working towards some particular goal, we can work together also and find out good solutions and good academic output also. Like I would like to share one example here, that we have a at the regional level, at the Southeast Asia level, IHMR University has been very strongly working on South Public Health Education Institutions Network. We have this network supported by WHO CRO, and under this network, around 60 to 70 public health education institutions are working closely. And when we say working closely, we meet and very frequently. We are working closely for conducting the capacity building programs. We are working closely for doing the research work jointly, and we are also working towards now how we can transfer the credits, like credit transfer may be one of the things that we should think. Since in India now we have a new education policy, and that clearly says that the credit transfer should be implemented in a nicely way, so that the students should not suffer if they have earned some credit from other institution, other university. It should be vetted very well and given due credits and like that. So that will save a lot of time, and the student would be more encouraged for the higher education and other courses. So these are the few thoughts on this, Professor Tripathi, and I think the others can also join me. Thank you.
Thank you very much, Dr. Sodani, for suggesting the ways and areas of collaboration like fellowship, like joint faculty development program, and also developing the strategy for faculty development program and industry academia interface, that how we can work on. Now I come to Dr. McFarlane. Dr. McFarlane, what do you think could be some areas how we can innovatively collaborate?
Okay, thank you very much. One area that we can collaborate is how to do operational research, how we can work together to do some kind of operational research. Most of our graduates who are taking medicine typically, when they go to the field, it's rare they conduct some operational research, that they document what they are doing, for example, best practices or some bad practices, of course, may do that, so that if we collaborate on how we can build the capacity of the faculty and the students who are already in the field to conduct operational research will be one of the area which we can improve, because we'll get the vivid example from the field. We as a faculty, we are doing research, yes, but mainly of this research is maybe survey or a few of cohorts, but we are not part of working station. We are just going there for sometimes collecting data, analyzing our area, and then come up with the findings. But when we invest in operational research, it means automatically we will engage those previous students who are already in the field, will be our students on doing that kind of research, building on job capacity, as well ourselves also will be linked with the industry, because we work together now, document those practices and then publishing together. So we'll continue a tie with the industry where they are working, and at sometimes we will be learning, because there are a lot of changes, and while you are in class teaching, it's sometimes different from what is really practice. There are some kind of changes. That's one. But second, I think we should insist how we can include also the management aspect in the doctor of medicine programs like that, because these students mainly they are oriented on treatment and whatever, but when they are going to the field, especially in Tanzania, some they being given the position of who is like leadership, they don't have those leadership skills, and they come to work together with those students who was studying healthcare and management at university. So there are those kind of clashes. So if we improve also the syllabus, so we have the joint efforts of making sure that the syllabus for the medical doctors also includes some management aspects that will help them when they go to the area, they can be of health. And the last, I think, area is to impact soft skills to our students. There are some issues we may not teach them, but it's required at the field work. So we should also think how we can impact the soft skills for this student from the start, and globally how we can impact those kind of soft skills to these students, so that they can be of importance, or they can address the global changing kind of disease. Thank you.
Thank you, Dr. McFarlane, because you identified a very, very important area, that what type of curriculum should be built for on leadership and management, particularly for doctors who are medicine students who are learning, who are not getting much inputs on leadership and management. And that's one interesting area that you have suggested. Thank you. Milanko, what would be your thoughts on the collaboration areas? What could be some ways to promote effective healthcare management education? And for that, what specific areas you would like to suggest?
Thank you very much, Shiv. You started this round with the word innovation and innovative approaches. Whenever I talk about innovation, I try to emphasize the need for a harmony between different aspects of innovation in education, in management education, or in healthcare management education. Doesn't matter. We need to innovate programs. We need to innovate processes. We need to innovate actors involved, either faculty or students, and we need to innovate institutional and organizational arrangements. But what experience has shown worldwide is that innovation in only one aspect cannot work. Because if you innovate the program, automatically it implies the need for innovation in the processes, in the education process. That requires new generation of professors, not in terms of age, but in terms of their approach. And as already mentioned, students should be the center of these processes. They should own the educational process. And many innovations have already been mentioned, project-based, activity-based education, service-based education, involving students in research and so on and so forth. So a complex approach seeking for harmony. There is a need for harmony. This requires, I believe, internal dialogue within institutions and at the same time external dialogue with other institutions and other partners. Now, internal collaboration. I will share with you a very short anecdote. There was a graduation ceremony in one of the best business schools in Europe with executives who were, it was executive program, their families, business partners, companies, and so on. Big ceremony, big speeches from the rector, dean, and so on. Everybody was happy. And one of the speakers was the best student of the generation. So she spoke about their experience, how everything was wonderful, so everybody was happy. He said everything was perfect, but there was one thing that we were really all fascinated with, and that was the ice cream industry, the ice cream week, he said. And all the professors and dignitaries at the ceremony, they didn't know what he was referring to. But in the hall, there was big applause because students were happy. That was the highlight of their studies, the ice cream week. And at the end of the ceremony, the rector approached him. He said, "Oh, I like your speech. Thank you very much for your nice word. By the way, what did you mean with this ice cream week?" And he said, "Oh, it was fantastic. During the whole week, in HR management, in strategy, in information technology, in all disciplines, we had cases from the ice cream industry, which enables students to see the big picture. But this happened as a coincidence. Why? Because professors from different disciplines do not talk to each other. They don't talk. They attend conferences, they read journals from their disciplines, but they don't communicate. So it's like a father and a mother not communicating amongst themselves while educating their own children. So this is the internal dialogue that we desperately need. The external, I would say, is joining forces to faculty development, because my experience is that international program could be the best way, at least to create some core faculty, which later on can do the cascading down, and transfer their approaches. In the International Management Teachers Academy that I was in charge of, I had interviews with all the candidates, and I would like to share this with you. I asked each of them, look, there were teachers who wanted to attend the academy to become even better teachers. So I asked them at the end of the interview, who was the best ever teacher you had in your life? And the answer was silence. Or the answer was, oof, never thought of that. Now, it sounds like a paradox. You want to become a better teacher and you never asked yourself who was the best teacher you ever had. But then the answers were coming. And all the answers, or not a single answer, had to do anything with the technical expertise of the teacher. They all were about this care. He or she was the person who cared, who opened new horizons for me, who encouraged me to learn, and so on. So I think we need this kind of faculty development where we will create new generation, as I said, not in terms of age, but in terms of new approach, holistic approach to education. Maybe I took too much time, so I will stop here.
No, thank you. Thank you very much, Milanko, for highlighting and giving a new thought, a new topic, new area, that what a 360-degree innovation could be in academia, like holistic innovation. We're not only looking about product or process or service, but looking about things in totality. And definitely, our efforts should be to avoid repetition of ice cream weeks. So we need to work on how faculty can talk and how they can collaborate more. So to give better student experience for total wisdom and understanding development. Thank you. I come to Professor Vinita. I realize that it's close to midnight and in Malaysia. Apologies for that, and thank you for still being with us in panel. Please, what would be your thoughts on collaborative?
Thank you. No worries. I have mastered the art of sleeping with my eyes open, so that's okay, right? So I think what we need to do is look at how research. I agree with Dr. Sodani that research is very important, but research has to be meaningful, right? There's sometimes that we read a research paper and we don't know what to do with it. The best research paper is when you can take it to the ground and actually experiment with it. So I'd like to encourage academics to do research that is meaningful, right? And when we do that, it is also time for us to relook at the curriculum. And when we are looking at curriculum, let us not take away the social and the humanistic aspects of it. Let us put in a very nice framework that actually I'm working on. It's called VIN. It's the 3 letters of my name, if you know. And it is about putting in values, right? Whether it's ethical values, social values, etc., into your curriculum. And that actually gives people an opportunity to reflect, to think about how, as an individual, I contribute to that discipline, right? In healthcare, it's probably very important. The other one is your influence. As an individual, how do you influence the outcome of that discipline, of that module, or of that curriculum? And the N is actually the norms. How do you now create a norm that is then practiced and it makes an impact? So one of the things that we can do to make education globally attractive is for groups of people like ourselves to get together and create modules that can be taken by any university throughout the world. So what we really need to understand is we are very fortunate at the moment that we have learned how exciting it is to join conferences where I don't have to travel so much, although I would love to have been in India. But if we can't travel, I can now do 8 conferences in a week and still be very happy about it, right? So let's bring this kind of opportunity for our students. We can have global classrooms, so we can have expertise teaching and students logging on and learning. We can have digital social innovation labs. So I lead a university that we serve the underserved students. So most of our students come from rural Malaysia. And I would love to take people to our villages and to understand some of the issues that they're having with basic healthcare needs. And maybe there's something that someone else from across the globe can look at it differently and say, you know, why don't you do this? And things would be different. So for our students, I think it is an amazing opportunity if we could develop a module that they can take for credit, right? If they cannot come over to Malaysia, or we cannot go over because it's too expensive, but there is a lot of opportunity for us to do a module that students from various countries can take. They can also now share and understand different values. How we work with rural Malaysia may be quite different with how you work in Tanzania or you work in India. So bottom line is, I think we need to communicate better. We need to reflect on our actions, and we need to really listen. Sometimes as an academic, we forget that listening is the most important. And over this year, what I have personally benefited from was reverse mentoring. I am not absolutely good in using technology, but the students actually helped me through that process. So that there is a newfound appreciation for my students, because they now tell me that, look, if you want to upload something, why don't you use this drive as opposed to using something else? So if we can understand that sometimes our students can help us be better teachers. That is something that I would like to just share with this group. Yeah, Dr. Shiv, over to you. Thank you very much.
Thank you very much, Professor Vinita. First thing that you mentioned about the relevance of research, that it's not only the pieces that we publish in the so-called good journals, but what can be implemented. And that's, I think, one of the most important issues that the academia must look into. What I sometimes find that it's also because partly it's because of the type of accreditation framework and accreditation regime that we have, where the numbers matter instead of impact, looking into the impact. And this gives an idea that for the like-minded institutions and the group of people who are really concerned with ensuring the effectiveness of education and collaborative education, to propose an alternative model of accreditation, where accreditation is based on impact, not on so-called criterias of which suits to one disciplinary context, but not all the disciplinary context. And thank you for highlighting this, because you mentioned a very important point about global classroom or collective module. And definitely it's an invitation to all the panelists and all the attendees. If any one of you would like to contribute to this type of collective module development, you can later, we can connect and we can exchange ideas. So thank you very much. Now I come to Professor Kyriakos for, sir, what you feel could be some good collaborative models for promoting effective education based on your experience across continents, across places, countries, while leading the different schools and universities.
Thank you, Dr. Siv. In one phrase, if I can use, I would say that what is needed is what we call a new learning in healthcare management education. It is also certain that the future of education will eliminate the classroom. Also the borders between countries, all the stereotypes we currently know for acquired knowledge. Technology has already turned our entire lives into living and learning experiences. a common thing that we need to understand is that technology is not just helping education, but it has created its own methodology in education. So it's not like a helping tool. We need to go deep inside and build a new methodological framework and understand what is happening right now around us in order to be more effective. I'm going to give you some very interesting numbers, especially for ICT, communication and technological issues. Currently, right now, around 2.7 billion people, that is a huge percentage of the world population, are online at the same time. Europe is a region where technology, because I'm currently in Europe now, has reached an amazing number of 75%. That's the highest internet penetration in the world. That means it's a huge audience for us to try and use new methodological ways of enhancing educational patterns. And another tremendously growing area has to do with mobile learning. And here we had an increase for the last, let's say, 10 years from 2010. So the e-learning mobile number is now currently more than $50 billion for producing new concepts and producing new apps and new ways of learning. And one of the most important developments, let's say, in healthcare education in particular, apart from application of new technological developments and mobile learning and the use of the internet that I mentioned, is also the translation now of qualifications into outcomes and competencies. Now we have what we call micro-learning, micro-credentials. We're trying to build new curricula, build new syllabi. It's like we're playing with Legos. We have new credit structure. We add apprenticeships. We add practical sessions, and we give a new set of scholarships and fellowships. So all these, they create a new getaway, let's say, for education and also for social mobility. So we need to replace the old existing models with a new system in which learning is conceived as a flow. You can say that it's another definition of lifelong learning, but it's not just that. It's this accompanied with everything we have achieved so far in education. So this new constant flow, that means new opportunities for learning. The learners increasingly have new potential and new abilities to be autonomous and continue to study and experience new memories and construct new knowledge at their own pace in their free time or in the time they have outside their professional activities. So this is called, let's say, a new era in education, which is social structure. So rapid learning, together with this, learning resources, all these, they create more opportunities for a better life for more people. And in the era that we're actually living, we can say we're also in transition. There are a lot of great things that are coming ahead. Most of these are still unknown to us. As you probably know, if a kid is born today, nearly 50% of the professions that he or she may be engaged in the future, they have not been invented yet. So it's a very interesting era that we're living right now. So back to you, Mr. Dr. Siva. Try to respect the time.
Thank you very much. And yes, we require transformation in academic structures, as you mentioned. And particularly when we are discussing about embedding the technology in education, the way that we define the credit and the way we define the credit structure and micro-credentials, as you mentioned, with the learning flow, that's, I think, is going to be the way forward, as you mentioned. And we need to collaborate more on that in order to provide a flexible and effective education to the target learning group. Thank you very much, Professor Kyriakos. And now, with 5 minutes left to the end of this event, we will not go to next round because I think we had sufficient exchange of thoughts. And if there are one or two or few questions from the participants who would like to ask, I would request them to raise hands so that they can ask question if they want to ask. And I can see Mr. Rajesh Nayak raised hand, I think, but now no. Anyone who would like to ask anything to the group? Any questions? Earlier there were some hands, but now I think that with the time people don't think, or either they have got all the answers, or after 120 minutes of online engagement, they don't want to ask anything now. I would request all the panelists to please on the camera so that we can take a picture together. Dr. Dev Tiwari, if your camera is working now, it would be great. Otherwise, it's fine. And Dr. McFarlane, we can take a picture of a screenshot of all the panelists before we close. Thank you very much. On behalf of IIHMR University organizing team, I am thankful to all the distinguished speakers and attendees who from different time zones at this hour are here with us for continuously 2 hours. Mr. Ramu Damodaran, it's a weekday. I know how busy your schedule would be. It should be around 11 in New York, and you are with us. Thank you so much for being with us and setting an inspiring foundation for the discussion. Thank you very much. I'm thankful to Professor Kyriakos for his participation, wonderful thoughts in shaping the discussion. I'm grateful to Dr. Vinita, who suggested the idea, who triggered the idea of forming a new form of collaboration which works more on empathy and care for providing the effective education. I'm thankful to Mr. Milenko for philosophically indicating at different interesting points, and one very, very interesting point of ice cream week that you mentioned, definitely we would remember, and we will see that how we can avoid I'm back. I think there was something with technology. So thanks, Milenko. I'm thankful to Dr. McFarlane for being with us. I'm thankful to Dr. Dev Tiwari for his time from University of Zululand. I'm thankful to Dr. Sodani for all his support in conceptualizing, planning, and organizing this workshop, and then for his participation as active participant and speaker to the event. I am very much grateful to all the attendees from different parts of world who very patiently have been with us, and to my technical team, IT team, Mr. Hiten, the marketing team, Mr. Manu, the PR team, Mr. Sanovar and Sapna, who are behind this for promoting this event and for covering the event. So thank you all. Have a wonderful evening, wonderful day. Very good night. Very much look forward to continued action. Namaste.
Namaste.